Okay, so we left off speaking about trap and distinguishing trap from summation. So trap, the main difference between trap and summation, we said, was that in between trap, we have full relaxation of the muscle contraction where the tension generation goes to zero. And the idea behind trap is that the sarcomeres, the sarcoplasmic reticulum, the ryanodine receptors, the DHP receptors, all of the internal machinery that's needed for the contraction is already warmed up. So there's not calcium in the cytoplasm, but the machinery is already warmed up. And so it takes less time to generate more force. So that is the reason why when we have subsequent action potentials that are arriving close in time, they produce more force until we get to the maximum force possible for that muscle. Now with summation, it's easier to understand summation. We began looking at the length of time here. So an action potential is a couple milliseconds, 1 to 2 milliseconds. A contraction can last anywhere up to 200 milliseconds. So 10 to about 200 milliseconds. So within the time that it takes for one complete contraction, we can have multiple action potentials arriving on the muscle fiber. So those contractions can begin to overlap and then they can sum. So this better explains why the next action potential that comes along produces more force generation, right? Because they're overlapping in time. So here is the muscle stimulated. So here's what one twitch represents. In other words, one action potential, right? The muscle fully recovers or goes back to rest. Another action potential comes along. The muscle contracts again. Notice that the relaxation is not complete this time. So the tension does not go to zero. And so the next action potential that comes along automatically starts at a higher tension. And so will generate more force than the first action potential. And likewise with the third action potential as well. So the reason for this is that calcium is still in the sarcoplasm. As we can see, the force does not go to zero in between each of these individual contractions. So because there's still calcium in the cytoplasm, the calcium is still bound to troponin. There's still some cross-bridge cycling happening in between these contractions, and then the next contraction just sort of compounds that. Now we can have multiple action potentials to the point of tetanus, which is basically sustained contraction with no relaxation in between. And that can be incomplete or unfused tetanus. And if we continue to increase the frequency of action potentials, that would lead to complete tetanus or fused tetanus, where there's absolutely zero relaxation happening between the action potentials. They're all just summing to one large combined sustained contraction. All right, so that is what tetanus is. Basically just speeding up the action potentials to the point where the muscle does not contract and it just maintains that contraction, right? This can also be compared to muscle spasms. That's what's happening when the muscle begins to spasm, is that it's not being allowed to relax because it's just continually stimulated. So when we think about summation and tetanus, the reason here is the amount of calcium that's bound to troponin. So because troponin still has calcium bound to it, it will still be allowing the myosin binding sites to bind myosin, which is equal cross-bridge cycling, right? So cross-bridge cycling equals contraction or force generation. So at high frequencies, the amount of reuptake, so the calcium ACPase pumps that should be reuptaking calcium back into the SR, that decreases, right? The reuptake is decreased as compared to the calcium release into the cytosol or sarcoplasm. This eventually saturates the system. So when all troponin has the max amount of calcium bound to it, then we pretty much max out the cross-bridge cycling. And then that is what leads to the maximum tetanic contractions or that fused tetanus, all right, which is basically zero relaxation of the muscle. Okay, so that was one factor, right? Let's kind of sort of organize these points as we discuss them. So overall, we're looking at factors that affect force generation by a single muscle fiber. The first one that we just described was the frequency of the action potentials. So the faster that we can stimulate the muscle, the more force can be generated. The second factor we're going to move on to look at here is the fiber diameter. So how large is that muscle fiber? And the reason that that matters is because the muscle fiber tells us two things. How many sarcomeres are in there, right? In other words, if you have lots of myofibrils, then we have more sarcomeres. So we have more potential for cross-bridge cycling. It also tells us the number of cross-bridge cycles, right? So the number of sarcomeres in parallel, as well as the number of cross-bridge cycles that are happening per sarcomere. So those two factors are sort of subdivisions of the fiber diameter. And both of those, if we increase the number of sarcomeres by way of having more myofibrils in the muscle, then we generate more force. And if we have more cross-bridge cycling happening on each sarcomere, then we also generate more force, okay? We also want to think about how that relates to the overall diameter of the muscle fiber. Now, the number of thick and thin filaments is constant. We can't manipulate how many thick and thin filaments are on a muscle sarcomere. Okay, what we can do is change the diameter by adding more filaments. So if you remind yourself of the muscle structure, we have the muscle fiber, which has many muscle filaments inside, in other words, myofibrils. So by working out or by undergoing strength training, we actually add more of those filaments or myofibrils. And because they all have more sarcomeres and cross bridges, then we have more force generated by the muscle. So this is what happens when you go to the gym. The muscle gets larger, right? The diameter of each fiber gets larger because we've added more filaments, which equals more contraction or more force. So that is the way we can increase the amount of force generated by muscles, just making them bigger. Let's look at the third factor here, which is the length of the fiber. And this one is less, we have less control over this in our body, but the length of the fiber at the onset of the contraction greatly impacts how much force the muscle fiber will generate. Again, we don't have much control over this because our muscles in our body are suspended across bones. So it's attached to bones at 2 points. And so the length there is not necessarily changeable. The resting length is typically going to give us the greatest amount of tension. So we don't want the muscle to be too stretched. We don't want the muscle to be too contracted when the contractions start. We want them to be at a nice optimal resting length, and they will generate the maximum amount of tension at that sort of middle resting length. So the reason for this is because we want to have the maximum overlap. We want to have the maximum amount of space for cross-bridge cycling to happen. So the way that muscles are in our body, the way that they are in situ, is that they are already at their optimal length, and so they will typically generate the maximum amount of force. So let's illustrate that here. So we're looking at tension, and we're looking at the percent of the maximum. So how much of the maximum amount of force for this muscle is it currently generating? Then we're going to look at the length, right? The percent of the resting length of the muscle as well. Now, when we start with the scenario of having the sarcomere greater than optimal length, right, which is kind of what's happening out here, notice how stretched out the filaments are. The Z lines are way out here, right? The myosin filaments are way in here, and the sarcomere is starting out really stretched, which is greater than its resting length, 160% greater than its normal resting length. In that instance, we're not going to have the maximum amount of overlap when cross-bridge cycling begins because it's starting from too far of a position, right? Too stretched out. So that will decrease the amount of force that can be generated from this muscle. Now, on the opposite end of that spectrum, we have less than optimal, which is happening over here. And this is about 60% of the resting length for this muscle fiber. So when we start there, we're starting way too contracted. So the thin and thick filaments are already overlapping. There isn't much area for sliding to happen, right? Because the Z discs are just way too close together. So this length is less than optimal and will not generate the maximum amount of force that's possible for this muscle. Now, the ideal or optimal length is up here, all right, which is at 100% the resting length, right? Just perfectly at rest. And the sarcomere is neither too contracted nor too expanded, but it's at the perfect length to have the optimal amount of sliding or cross-bridging to generate the maximum amount of force. Again, if you look at the force generation, it's at 100% that is possible for this muscle. Okay, so the position or length of the sarcomere also greatly impacts the amount of force that can be generated.